A lot of diabetic patients are on the wrong drug. A lot of people living with diabetes have been battling with either high sugar or low sugar. And the reason is that they are on the wrong drug. The drugs they are using is not the right drug for them. You see people that are on tablets or they are on any kind of diabetic drugs that are not supposed to be on any drug at all. I told you some people with early type 2 diabetes can reverse diabetes. I have a lot of my patients that are only on lifestyle modification, that is exercise and watching their diet. They don't need any drug. A lot of diabetic patients are on drugs that are not enough for them. So you see their blood sugar is always high. I've met a patient that said his blood sugar for over 10 years has been bad. Other people are on drugs that are too much for them. So whenever they take the drugs, the blood sugar will just drop. They will have low sugar level and they will need to take anything that has sugar for them to normalize, because they will be having excessive sweating, their heart will be beating, they will be shaking and other things. So that means that they are on the wrong drug. There are a lot of patients that are on medications, tablets instead of insulin. I've told you that there are different types of diabetes. There's type 1 and type 2. You know, type 1, they don't have any insulin and therefore they need insulin, while type 2, they can do well on tablets. So you see people that have type 1 that are on tablets, of course their blood sugar will always be high. Then you see type 2 diabetic patients that do not need insulin but are giving insulin. You see that their blood sugar is always low. So they should be on tablets, not insulin. If there's any reason why a type 2 diabetic patient is on insulin, when you solve that problem, that patient should be taken back to his tablets. So it is important that every diabetic patient should be on the right medication there, so as to avoid high blood sugar for long that will bring a lot of complications, or low blood sugar that also is very, very serious and can cause other problems. So tell me in the comment section, do you think you're on the right drug, or you think the drug you're taking is giving you either low blood sugar or is unable to control your blood sugar? But a word of caution: for you to say that the drug is not the right drug for you, you must be sure you're following instructions in terms of diet and exercise.